If you have knee pain, back pain, hip pain that's stopping you from doing the things you love, hiking, biking, chasing your kids, this is the guy you're going to want to see. This is Dr. Crovetti of Crovetti Orthopaedics and Sports Medicine. You do have surgical options, but I got to say, I've had surgery. I did not recover in a suite as beautiful as this. It looks like we're in a hotel room.
Well, certainly if you need surgery, if you need a new hip, you need a new knee, you probably want to end up here in your recovery.
So nice.
Right? You got your own bed, you got your own staff, you got your private therapist.
You guys are really changing the perception of how pain is managed.
So what we're doing here at Crovetti Orthopaedics is we're developing different alternatives, regional blocks where we actually numb part of your leg, different nerves that we numb that help prevent the pain after surgery instead of dumping a bunch of pills.
Pharmacists sometimes are making it difficult for you, so you have to find alternative ways.
If you can believe it, 2 or 3 weeks after a knee replacement, you still need medication before you go to therapy. It's becoming really difficult to get medication. So that's our goal in developing these alternatives. Let's decrease the medication, make it last a little bit longer by not needing as much after surgery.
You're keeping the pain management and the alternative pain management under one roof here.
Right, and my goal is to manage the pain afterwards, but I'm not a pain guy. I'm the surgeon, right? I'm the guy that fixes it. So why not bring somebody great in to develop those solutions and help us implement them and control postoperative pain?
So now that you've brought on Dr. Thomas Kuchera, it all stays under one roof. So let's go meet him. Dr. Kuchera, nice to meet you. Welcome to the family.
Yes.
So you actually call yourself a detective. What does that mean to you?
That's what I tell my patients, is basically when people come to me, they're in pain. And so I have to spend the time with the patient and really find out what is the source of the pain in order to do the appropriate intervention.
And after surgery, if that's what you choose to have here, you can help manage that pain.
You know, there's lots of options, and not narcotics or opioids aren't the only option. Physical therapy, rehab, we individual approach to what your goals are. There's no one blanket fix. You have to cater to each patient.
What is PRP?
So PRP is platelet-rich plasma.
Okay.
That's a fancy term for you're taking your own blood, you're spinning it down, and you're taking out the growth factors, which are really important to healing, right?
Okay.
And so it's actually been used not just in sports injuries. Now people are using it for cosmetic reasons and hair restorations. It's really a new field of science that's been around for the last 10, 20 years, but really popularized in the last 5.
I've also heard you talk about nerve blocking. What is that?
And there's 2 types of nerves, motor and sensory nerves. Motor nerves, what scares people and gives you things where important strength, but then there's a sensory nerve, which is what gives you the pain, which gives you the touch. You can heat these nerves up, you can actually cool them, something called cryoneurolysis, which is basically the best way, is just cooling it down so it really takes away your pain.
So you can actually get all up in there, and that little nerve is kind of the culprit there of causing our pain.
And you can do it precision guided with ultrasound, you can do it with x-ray, you can also do it anatomically, but you know, here at Crovetti Ortho, we really do use the newest either x-ray guided techniques or ultrasound guided techniques to really pinpoint that nerve and go after what's causing the pain.
So all of your orthopedic and pain management care all under one roof now. Crovetti Orthopaedics and Sports Medicine. If you've got pain, we're talking about knees, hips, back, shoulders, go to CrovettiOrtho.com to get more information. They're located right here in Henderson.